There were 240 cases of COVID reported in New South Wales, and of these, 239 were locally acquired and one was overseas acquired. It was pleasing to see that testing volume, 110,962. But, disturbingly, we're still seeing these case numbers rise, and we're still seeing too many people infectious in the community. Sadly, we've had 2 COVID-related deaths, and a woman in her 90s from southwestern Sydney died yesterday morning at Liverpool Hospital, and she was not vaccinated and was a household contact of a confirmed case. She's not linked to the Liverpool Hospital cluster. And there was a gentleman in his 80s from southwestern Sydney who died yesterday afternoon at Royal North Shore. And again, he was not vaccinated and was a household contact of a confirmed case. Can I just extend my sincere sympathies to the families? But I think these deaths do highlight a key issue. At this level of cases, we are going to continue to see further deaths. And sadly, too many elderly people in our community are not protected. When I reviewed the Commonwealth vaccination data, which is readily available online, sadly, 25% of people over 70 are still yet to receive their first dose. I cannot urge you as members of the community to reach out and support your elderly family members and friends to get vaccinated. The vaccine does not work immediately in providing protection, but even one vaccine can reduce your risk of hospitalisation and death, and it can also prevent onward transmission. But it is critical that elderly people get vaccinated. I think one of the interesting things for people to reflect on is the challenges we'd had with aged care early on in the first wave. And what we've seen is we've had a number of workers in aged cares, but the consequences have been much less severe because of the high rates of vaccination rates in those settings. So again, I don't think you need more evidence that vaccines will save lives and COVID will kill. So please get vaccinated. There are currently 182 COVID cases admitted to hospital, 54 people in intensive care, and 22 whom require ventilation. And they're young. Many of the cases are young. We've got 2 in their teens, 8 are in their 20s, 4 are in their 30s, and 3 are in their 40s. So it's not only an old person's disease. So everyone should discuss vaccination, and my message is get vaccinated. I'd also just like to raise the fact that we have lots more access points for vaccine. So we have pharmacies that are opening up across the state, providing AstraZeneca vaccine, and we also have local initiatives. So I urge you to go to the website and find out about those. I'd just like to give a big call out for a couple. One is the Prairie Wood AstraZeneca Vaccination Clinic at the Prairie Wood Youth and Community Centre in Restful Road, Prairie Wood. It operates 7 days a week from 8 a.m. to 4:30, and you can just walk in. So I challenge the community in that area, go and get vaccinated today. There's also a clinic being set up today on Thursday the 29th at the Alan Easy Community Centre, 1 Newport Street, Pemulwuy. But there are a variety of access points. So your GP, pharmacist, and also the health service are providing a number of clinics. I just wanted to alert you to one other issue, that a staff member who works at Royal Prince Alfred's Hospital's emergency department tested positive to COVID, and the staff member is fully vaccinated, but was potentially infectious whilst at work on a number of days on July 24th, July 25th, July 26th, and July 27th. And just to reiterate that the person didn't have any symptoms, and they tested positive with a regular surveillance test. Now, obviously, all close contacts and casual contacts are being identified and contacted, and there's been no evidence of transmission to date to staff or patients, and the emergency department has been thoroughly cleaned and there's no disruption to patient care.